Hey, it's Dr. Jay Bernstein. Just want to give you a health tip. We'll talk about exercise. I just ran 7 miles today. That's now 29 miles I ran since Sunday. I took a day off also this week in between, so quite a bit of mileage I did. And I'm just telling you that because I want to let you know that I practice what I preach, and what I'm going to preach is that exercise is the single best thing you can do for your health. There's many different ways of looking at it. If you want to look at it by bodily system, exercise helps nearly every bodily system. If you go by systems like the psychiatric system, the neurologic system, the respiratory system, the cardiovascular system, the endocrine system, the immune system, the musculoskeletal system, the GI system. I mean, exercise helps every system. And interestingly, just as a side note, opiates does the opposite. If you go by systems, it affects every single system in a negative way, nearly all systems. So yeah, exercise the opposite. Even when you even not talking about going by systems, exercise decreases the risk of cancer, many different cancers, and a lot of research backing this up, showing it in many different ways. One way is even like pre-cancer, where PSA levels in men are going up, which is a marker for prostate cancer. When those levels are going up, you can, even before a person gets cancer, you can bring it back down by exercise. So exercise is amazing. There's no pharmaceutical that can decrease the risk of cancer. There's no pharmaceutical that can come close to exercise. Even cardiovascular system, you want to compare statins to exercise. Exercise can actually decrease coronary artery disease. Done by there was some studies done by a cardiologist named Dr. Dean Ornish. He's been able to show that exercise is more powerful than even a statin, which is we take for cholesterol. The cholesterol medication can still slow the progression of coronary disease, but it can't unravel it. It can't decrease it. Exercise can. So what is exercise? Exercise what I'm referring to is the exercise you need to do per week, and that's how really you can measure the benefits and how you can have continual benefits, is to really go by week by week number of minutes. The first goal should be, if you're not exercising that much or exercising at all, try to make your goal to work your way up to 150 minutes. You get significant improvement. The learning curve, so to speak, is going up quite steeply to about 150 minutes a week. And you can break it up twice a week, 3 times a week, 5 times a week. So if you take a day off, you can catch up. So if that's sort of a plateau, and then you want to really maximize your benefit, and you're going up to 300 minutes a week. And what am I talking about exactly when I say exercise? How much exercise? How vigorous? Well, we're talking moderate to vigorous. Okay. Vigorous exercise is 70 to 85% of your maximum heart rate. Moderate, a little bit below that. If you want to, let's just say hypothetically, you want to target your heart rate to be 70% of your maximum, which is right in the middle between moderate and vigorous. The two quick ways to calculate that, to understand that, is you take the number 220 minus your age. That number, multiply that by the percent of what your goal should be. I go for about 80% myself. So I take my heart rate again, which my maximum heart rate, which is 220 minus my age. That's my maximum heart rate multiplied by 80%. That's what my target heart rate is. I try to make that heart rate, consistent. So moderate to vigorous exercise, even go up to 300 minutes a week. You can get down to your ideal body weight. So it's very powerful tool to not only stay away from disease, but also helps depression. It helps. It's going to help many different things in your life. It'll help decrease the likelihood of cancer. So happy exercise.